Autophagy plays a vital yet often underappreciated role in maintaining immune system function across the lifespan, with significant implications for both cancer prevention and the aging process. As a fundamental mechanism for cellular maintenance, autophagy is not only responsible for clearing internal debris, but also for shaping the way immune cells detect and respond to threats. Through this lens, autophagy acts as a bridge between metabolic health, immune vigilance, and disease resistance, especially when it comes to cancer and age-related immune decline. In the context of immune surveillance, autophagy enhances the ability of key immune cells, such as macrophages, dendritic cells, and T lymphocytes, to function properly. These cells rely on autophagy to manage energy demands, remove damaged organelles, and regulate the presentation of antigens, the molecular signatures that allow the immune system to distinguish between self and non-self. Without effective autophagy, immune cells become less efficient at identifying and eliminating abnormal or transformed cells, allowing early cancerous lesions to escape detection and grow unnoticed. In tumor biology, this immune autophagy link is particularly important. For example, dendritic cells use autophagy to process tumor antigens and present them to T cells, initiating a coordinated immune response against cancer. Autophagy also supports the survival and memory function of cytotoxic T cells, which are essential for long-term anti-tumor immunity. If autophagy is impaired, this entire chain of defense begins to falter, antigen presentation becomes inefficient, T cell responses weaken, and tumors gain a greater chance of evading immune clearance. As the body ages, the decline in autophagic capacity contributes directly to the weakening of immune function, a phenomenon known as immunosenescence. Older individuals experience reduced numbers and functionality of naive T cells, diminished responses to new antigens, and chronic low-grade inflammation. This state makes it harder to fight infections, respond to vaccines, or recognize and destroy emerging tumor cells. Autophagy, when intact, helps delay these effects by preserving mitochondrial health, reducing oxidative stress in immune cells, and maintaining the energy balance required for effective immune responses. But as autophagy declines with age, so does immune resilience, leaving the body more vulnerable to cancer and infection alike. Encouragingly, strategies that enhance autophagy, such as caloric restriction, intermittent fasting, or pharmacological agents like spermidine and rapamycin, have shown promise in rejuvenating immune function in aging models. These interventions improve the function of hematopoietic stem cells, boost T cell activity, and reduce chronic inflammation, all of which contribute to a more vigilant and efficient immune system. In cancer research, there is growing interest in using autophagy modulation to improve immunotherapy outcomes, particularly checkpoint inhibitors, by enhancing antigen presentation and T cell persistence within the tumor microenvironment. Still, as with many autophagy-related strategies, there are caveats. In some advanced tumors, autophagy may aid immune evasion by helping cancer cells survive immune attack or by modulating immune signaling in ways that suppress T cell activation. This makes it essential to tailor autophagy-targeted therapies carefully, balancing the need to enhance immune competence without giving tumors additional survival advantages. Autophagy's contribution to immune surveillance illustrates its broader role in systemic health. It's not merely a recycling mechanism within individual cells, but a key regulator of how the body defends itself against cancer, against pathogens, and against the cumulative damage of aging. By supporting immune function at the cellular level, autophagy sustains a line of defense that becomes increasingly critical with age. When autophagy falters, so too does the body's ability to recognize and destroy its most dangerous enemies. But when supported with precision and care, autophagy can act as a quiet but powerful ally in the fight for longevity and resilience.